I said, I don't tie women's tubes when they're less than 35. 186 comments later, or 200 comments later, all sorts of women coming out of the woodwork saying that I should have my license revoked because of the fact that I was refusing treatment. Yeah, it's my prerogative to refuse treatment because just Friday that passed, a couple days ago, two women did consults with me because they had tied their tubes when they were young. And they literally both said, I wish I had understood better when I was doing it, that it was the wrong time to do it, and that I didn't understand it back then. I thought I was doing the right thing, but I wasn't. So I hear that every day. And so I don't tie women's tubes because I hear that bloody thing every day. So I don't want to do something permanent. I want to do something less permanent. But, I told everybody there, I tell my patients the risks, I tell them the benefits, and if I don't believe in it and I don't support it, I'm going to tell you, look, I really think you're making a mistake here. And because I think you're making a mistake, here are your options. I'm not going to tie your tubes, but if you want me to refer you to someone that will, I'll help you out. I don't want to be the one responsible for you making a bad decision. I'll give you an even better example from today. I had a lady contact me today who's 48 years old. She contacted me to reverse her tubal ligation. She had tied her tubes. She wanted to reverse. The reality is that lovely patient, very, very nice lady, and her partner have probably a 0.1% chance of having a natural conception at 48 years of age with previously tied tubes and undoubtedly, diminished ovarian reserve. Based on that, I said, listen, like, I can do it if you ask me to, but I literally told her, I think this would border on being unethical. It doesn't make sense. The chances are so low I'm taking money from you to do something I know won't work. So here are some other options. And we reviewed the alternative options and I spelled them all out and said, listen, ultimately, if this is something you want, I'll do my best to discourage you, but like, I guess I'd let you do it if that's the only route you want to take. But I think there are much better options for you, and here they are. So I'm still curious. Like, I want to know what other people think.
Oh, there's a lot of people with a lot of thoughts.
Yeah, I want to hear